So I'm Sarah Sinclair, I'm Managing Editor of Cannabis Health, and this webinar is being hosted in partnership with Integro Medical Clinics and CPAS. So a big thank you to them for helping make this happen as well. Tonight we're discussing the menopause and sharing the experiences of women who found cannabis and CBD helpful in managing symptoms. But as with all of these events, we really hope that this discussion will go beyond that and explore the many challenges facing women at this point in their lives. According to the British Menopause Society, menopausal symptoms affect more than 75% of women and last an average of 7 years. To put it into context, there are thought to be around 13 million women currently going through the menopause in the UK at the moment. That's a third of the entire UK population. And yet, if you speak to many women going through this, they say they felt isolated and often unsupported by their doctors and GPs. The lack of awareness and understanding sometimes means that even women themselves may not realise when they first start to experience symptoms what's going on. While we associate hot sweats with the menopause quite commonly, many people aren't aware of other symptoms such as low mood, anxiety, depression, insomnia, poor memory, and brain fog, which can all have a huge impact on a woman's daily life. But menopause and perimenopause symptoms are chronically poorly treated in the modern healthcare system. I've heard from women who've told me they've been told by their GP to manage their stress better, lose weight, or do more exercise when seeking medical treatment for symptoms. And this is due to a wide range of factors, both cultural and medical, while women often feel ashamed to speak openly about their experiences due to stigma. We seem to have this obsession with youth in society. So women often feel ashamed to admit that they have reached that age. And also it's doctors aren't trained and don't have the time often to treat these symptoms effectively. So while cannabinoids can't be specifically prescribed for menopause yet in the UK, given what we already know about them, it's not surprising that many women find them helpful for some of the symptoms such as anxiety, sleep, and stress, as we'll hear tonight from our panel. So first of all, I'm going to introduce Rachel Mason, who is the founder of Our Remedy CBD. Rachel, after studying graphic design, founded 2 startups, a healthy eating cafe and a vape brand. But after going through some serious health issues of her own, which I'm sure she'll tell you about soon, she found CBD really helpful and even launched her own wellness brand focusing on women. Driven by her passion for the environment, Rachel has created the UK's first plastic-free CBD oil with a focus on women's health. Dr. Sally Gozala is a pain management consultant in the NHS who prescribes cannabis medicines and is the women's pain expert at Integro Medical Clinics, which she joined earlier this year. Sally specialises in managing patients with a wide range of pain conditions, has a particular interest in bladder and abdominal pain and women's health in general. Sarah Higgins is a clinical nurse specialist with over 10 years experience in the NHS. She developed an interest in medical cannabis and its application in women's health following the implementation of routine screening for recreational drug use and reproductive health services. Sarah is also the women's health lead at the non-profit organisation CPAS Nurses Arm. And you might have noticed we have an additional guest joining us tonight who is very brave to be joining this panel of incredible, strong women, but I'm sure he can hold his own. We thought it was important to have someone here who could talk about the psychiatric aspect, as it's usually the mental health indications which are prescribed for. So Dr. Maya Bodini, thank you for joining us. He is the neuropsychiatrist at Integro Clinics, qualified in both general medicine and neuropsychiatry, and has over 25 years experience in the field. He prescribes cannabis medicines at Integro for mental health related conditions. Okay, so just while we're waiting for Helen to hopefully join us, Rachel, would you mind just kicking us off with a little bit about your story and how you came to CBD? I think you're on mute, Rachel.
Oh. Is that okay now?
Yeah, perfect.
This classic line of 2020. Yeah. I think you're on mute.
Yeah.
So I'm Rachel. I am the founder of Our Remedy. I promise, I know I look really young. I am in the right webinar. So I have been through surgical menopause. So I'm going to tell you my story now about how I ended up in this situation. So it's kind of long, but it's a complex journey of all different women's health issues that I'm sure a lot of people will relate to in different ways. So everything started when I was about 25, 26, and my husband and I decided to start trying for a baby. And nothing was happening. So we went to the GP, and he said, I had an ultrasound and it looked like I had some cysts on my ovaries and I would need to have them removed because it looked like it was obstructing a pregnancy. So I had them done, I had them removed, and at the same time I had a test to check my tubes, and it turned out the cyst was removed, but also my tubes were blocked. So I learned from a very young age that I would never conceive naturally. He pretty much said I had zero chance of conceiving naturally. They were that blocked. I still don't actually know why. I was just told they were blocked. So we knew we'd have to go down the IVF route. So I had IVF, I was 27, 28, and that was successful. And I do have a son now. He's nearly 4. So yeah, that was good. That was all fine. When he was about a year old, I knew I wanted to have a second. I definitely wanted to have 2 children, and I knew I'd have to do IVF again. So I felt like at the time, like I just kind of wanted to be prepared for the IVF. I felt a little bit bloated, more than normal, and having had cysts in the past, I know that that's a symptom. I know that being bloated is a symptom of having a cyst, and I know to have IVF you can't have a cyst. So I thought, you know what, I'm just going to save time. I'm going to have an ultrasound and just double check it's all clear. So I had the ultrasound. I said I was feeling a bit bloated. They booked me in. I had an ultrasound on the Friday night. On the Monday morning, my world changed. So I got a phone call from my doctors saying, you need an emergency appointment with your GP. When can you go? And I said, I can go now, that's fine. And so I went to see my GP, and she was the most lovely lady. She really was. So going into this whole experience and this whole whirlwind was a very gentle entry. She said there was something on the ultrasound which wasn't a cyst, but they didn't know what it was. And I, at the time, didn't speak this language. So I had no idea what she was saying to me, but I do know now. So she sent me straight away for a blood test, which was to check my CA125. No idea what that means at the time. So I wasn't scared, but now I know that's my cancer markers. So I knew that they were going to check that. I got booked in straight away with a gynae oncologist. Again, you're 30, I had no idea what gynae oncologist does. Like it was just not something that affected my life. So it was all very strange, but I got booked in with him. My CA125 come back as raised, so that caused alarm bells. I got sent straight for an MRI. That revealed, that got sent to the gynae oncologist. That revealed a tumour on my right ovary. And the gynae oncologist, looking at that and speaking to me, said it looked like I would need open stomach surgery as soon as possible. It looked like a tumour, and it looked like it had taken over my whole right ovary. So one ovary, it looked like it had taken over. So I got booked in for that within 2 weeks. So it was all very fast. Had that surgery. They kept it all open at the time, me open, as in my stomach, and did a biopsy, and it come back as a borderline cancer. So it wasn't an invasive cancer. So it was caught really early and it wasn't invasive, and they took it out. But he said at my follow-up, so I had a couple of weeks to recover, which I did recover really quickly from the surgery. A couple of weeks later, I went back to him, and he said the only recommendation he would really have for me was a full hysterectomy, because he removed some of the cancer cells. But he said even within the time frame of the MRI and the laparotomy, they had spread to the other ovary. So it was a very, very fast growing tumour. And he said he hasn't seen that before. Borderline ovarian tumours are really under researched. He said that it was the only thing he recommended. And he sat there and said it with absolutely no sympathy. So I was like, I'm 30 years old, and like you don't really register at the time, but for me it was, I wasn't going to have a second child or carry one, because you can have a second child, but I wasn't going to carry another child. I wouldn't have another pregnancy. I didn't even think about the menopause at this point. And then one of the nurses took me to a side room. I was crying about the pregnancy thing, and she said, oh, like I had a hysterectomy young and the menopause isn't that bad. And I was like, oh my God, menopause as well. I was like, can this actually get any worse? This is awful. I'm 30 years old. I want another child. I'm 30. It was really horrible. So that was just scary. So I got 2 second opinions, something I feel is actually really, really important. And I push people to do now. You don't have to settle. I got 2 second opinions privately. And both of them said the same thing, to be honest. Everyone said the same thing. There's not enough research in it. It's risky. I saw IVF specialists about having a second child. I saw anyone that might do egg collection on me because I so desperately wanted to save something. No one would do it. I tried everything. So I spent like 4 months between finding out I have the hysterectomy to having it, trying to find out how I wouldn't have to have it, or I could at least preserve my fertility in some way. And this was obviously such a stressful time. I mean, I've got a notebook from this time of like doctor's numbers, hospital numbers. I was trying so hard. I was fighting it so hard. And I mean, I lost because I had to have it, but I still know that I tried so hard to find any way that I could. And I know that I needed to do that for myself. I actually ended up having the hysterectomy in London, and they're doing a research project at the time on cryopreservation of ovarian tissue. So I got into that. So actually my ovary, the little bit of it that was unaffected by the tumour, is on ice in London. So that's quite interesting. Like I learned a lot about what you can actually ask for during this time. So I got funding outside of my CCG, which is my community care group, to have it in London. I did learn a lot. I do feel like I went through a lot, and I was quite proud of myself even getting to the point where I managed to have it there. So this was a very, very difficult time. Like, as you can probably imagine, as very young, going through a hard time. I didn't really want to speak to anyone. I wasn't really sleeping very well. And this is the point when I discovered CBD. So actually before going into the menopause, but for anxiety, for sleep, like I wasn't really sleeping very well. I was just really worried. I was waking up in the night. It was just really tough. So that's the point when in my life when CBD come into play, started to help me sleep. And I thought, this is really amazing. And I was only then at this point, I've gone through so many health issues myself. I started talking to other women about their health issues. And one of my friends has endometriosis, and she said, well, CBD could help me. CBD started helping her as well. And it was helping me. And I realized it could help the menopause. And then I realized it could help period pains. And I thought, why is no one explaining this to women? Like, why am I looking at a bottle of CBD, which tasted not very nice to me? I just didn't think it even made sense. It was like a white bottle with a cannabis leaf. It was just very corporate, and I didn't feel anyone had been sympathetic towards women. And so I thought, I'm going to do it. I'm going to start a CBD company that's going to tell women, I'm going to make it look nice, and I want to tell women this could be really helpful to them. And what I tried to do was create a brand that kind of represented the really lovely doctor I saw at the beginning, who was so sympathetic towards me. And every time I spoke to her, she was so lovely, versus the other doctor who didn't seem to take on board how I might feel. And that's like, they kind of represented the way that I felt, to be honest. I didn't feel like I was understood. So I really hope I created a brand that kind of understands women's health issues a lot more. I talk about them, and I try to be really open about them. So I had the surgery. So that meant I had both ovaries removed. That's menopause straight away. So surgically induced menopause. At the age of 30, I went on to HRT straight away, which was requested by me. I did want to. I think I could have probably decided myself whether I wanted to or not, but I do want to. And I think eventually I will probably manage my symptoms naturally, because I do think I'm doing quite a good job. But I also know how young I am to have 20 years without it. So I've given myself a few years to stay on it. I do think I've been quite lucky in terms of menopause symptoms. I've always struggled a bit with sleep, as I've discussed, and I knew CBD helped, so I continued taking it for that. I think probably my worst menopause symptom has been forgetfulness, as these guys discovered last night, and I missed the first meeting for this, but that has definitely been my worst. I'll be sitting there but working on something, and I'll go, what was I doing? I look around the office and I have no idea. It's gone off my brain. That's probably been my worst. And dryness, that's not been very nice. But apart from that, I do think I've been managing my symptoms quite well. And I do think that CBD has been a massive, massive help in it. I noticed when I stopped taking it, I think it's been great. And the whole project of starting our remedy and trying to help other people has almost been like the second child I didn't have, because it does take over your life starting a business, as anyone will know that's been that invested in something. So kind of, yeah, that's the story really. That's what I've been through.
Thank you for explaining that so articulately, and it's really incredible what you've been through, and to come out the other side so sort of strong and confident and able to speak about it, it's really amazing. How have you dealt with sort of you said you sort of had that fear initially when you realized you were going to have to go through the menopause at 30, and how has that been, and how have you experienced stigma from kind of other people or yourself, or what's that been like?
Yeah, I think the stigma was definitely something I thought about straight away. I just can't even explain how embarrassed I was. To be honest, I was embarrassed even when I found out I wasn't going to be able to conceive naturally, and then I was going to go into the menopause. I couldn't imagine ever telling one of my friends. And I feel quite proud of myself that I can stand up and talk now, and you've told me how many people are here. So that definitely does change. But I couldn't even imagine telling my closest friends, and I have some really close friends, and I just thought, there's no way. I was like, I'm going to be a completely different person. I thought, so I am quite young in myself. I like to go out still. I like to enjoy brunches. I go on nights out. I am very social. I thought that would change. I thought I would be in baking shortbread and doing knitting. I couldn't imagine that I'd be the same person. Like, I literally couldn't comprehend it. And my husband's response was actually, but if you're happy doing those things, does it matter? And I thought, I don't want to change. I want to be myself. And what has actually happened is nothing has changed. I can promise you, my biggest fear was that I would change, and that hasn't happened. And I put that down to the fact that for some reason in society, we refer to the menopause as the change. And I don't know why we refer to it as that, because yes, your body will experience changes, but that doesn't mean that outwardly anyone would know. So I ended up, I have been quite open about it. It did take me a while. It did take me a few months before I really started speaking to people, but I spoke to my dad's wife, so my stepmom, and she was approaching 50, and I was speaking to her, and she said, I cannot believe you're talking to me about this. She said, like, I've been going through the menopause for a year. She said, the hot flushes are awful, and I can't bring myself to even go to my GP. She's like, I'm so embarrassed. I've been having hot sweats every few hours. She said, they've been horrendous. It's been a year and I don't know what to do. And I said, have you tried CBD? I said, you should give it a go. And she gave it a go, and she stopped having them. Like, she pretty much instantly, she still takes it now. It's been a couple of years and she does still take it. But she said from taking the CBD, they pretty much stopped. And I just felt so happy that I was able to talk to her and help her. And I thought, wow, just from being honest and having an honest conversation with somebody, that's what it can do. I think it's amazing.
Yeah, absolutely. I'm just going to bring in some of our sort of medical experts. Dr. Badani, Rachel mentioned there, obviously I know she's speaking specifically about CBD, but how it's helped with stress and anxiety. And is that something you find in patients at Integro? Do they come to you with kind of mental health symptoms that might be caused by something else?
Yes, I think it's true to say that the majority of patients who come to Integro for non-pain related or non-medical issues is symptomatic relief of insomnia, certainly anxiety, generalized anxiety or panic attacks, and associated with that is low mood. Those three symptoms certainly are the ones that I see. But going beyond the symptoms, it's important to get the diagnosis, and sometimes it's a careful assessment. Lots of factors, their early life history, experience of trauma, major surgeries or traumatic injuries of all sorts. Of course, they've all been through the NHS in various shapes and forms. And I think when they come to Integro or other medical prescribing clinics, they're looking for an alternative way of dealing with their symptoms, because the approaches that they've been exposed to haven't given them full satisfaction.
Yeah, absolutely. Rachel, would you kind of agree with that, your experience when you started seeking help for sort of the menopause side of things? What was that like in the NHS?
So I as I said, I didn't struggle that bad. It was only a year after my surgery that they booked in a medication review. So I think just to check everything was okay. And on the phone to the doctor, I said, I know it's a lockdown. I know that probably a lot of people aren't feeling great right now. I said, but I really don't feel great. I really didn't feel great at the time as well. And the person on the phone said, well, how much HRT are you taking? And I said, 4 pumps a day. And she said, okay, well, that's the max. You can't take any more. And I just thought, okay, so I'm meant to just live with how I'm feeling. That's it, really. You just got to continue. And that was the end of the conversation, really. I ended up doing a private hormone test via a company online where you prick your finger at home, drop the blood, send it off, and they send it back. I'd done one before the menopause because I wanted to know my hormone levels before it. And it come back as really, really raised estrogen, like crazy high levels, and testosterone. They were both really raised. And they rang me, the company rang me and said, you need to see your doctor ASAP. This isn't normal. So I rang my doctor and said, can I send you the lab reports? Because apparently this is really bad. So I sent it to them. And actually nobody contacted me, but I didn't really realize how bad it was. So I ended up pushing for help in the NHS, and they booked me into a menopause clinic. And that appointment is December 2021. So I haven't had it yet. That was in January, February this year. So it took nearly a year to get an appointment with the menopause clinic for the NHS. And I didn't realize how bad my levels were. So I booked another one this summer. I booked another hormone test. And I'm telling this story because I actually want people to be quite wary of this, because it was a really scary thing I went through. And the levels again come back as really raised, and actually they were worse than they were originally. So again, they rang me and said, have you spoke to a doctor? You really need to speak to someone. So I rang again and I said, apparently I really need to speak to someone. My levels are crazy. I had a hormone test privately as well, another one. And that come back as completely normal. My levels were completely normal. So what actually had happened is the HRT on my fingers had actually caused my levels to go crazy. So I don't think having hormone tests at home, whilst they probably are good for a lot of people, for very specialist situations, it's really bad. So the week that I waited to find out all of this, to find out the MRI result, was honestly really scary, because the lady just said there's nothing else really apart from the tumours being back. So that was a really scary week. And I really feel that I feel failed by so many people in that situation. Like, I should not have gone through any of that. I shouldn't have had to spend all that money. It was really quite a traumatic experience. And yes, I found out it was good news, and so I had something to be happy about, but that's not a nice thing to go through. So paying for private tests that are wrong, no one's really explaining to you your very special situation, you shouldn't have this, having to pay to go private, all of these things, it's not been easy. So I had an easy time with it up until kind of recently, but I am actually fine and my levels are apparently okay. So
well, I'm really glad to hear that after all that. Sarah, do you want to come in there? Have you heard of anyone kind of going through something like this before in your clinic? I think that's really interesting what Rachel said about the HRT on your fingers affecting the levels.
No, I mean, probably because when people start seeking private testing, they usually follow up, or those clinics provide a doctor consultation with it. But I can definitely see how that would influence your levels, and why the clinic would have been that concerned about it. I mean, I feel real empathy for you that you've had to spend so much money in order to get answers or follow-up care or specialist input. I mean, ideally, we would hope that you would have been followed up after the first 3 months of starting your treatment, just to check in and see that you're okay. Even if it was COVID, we are still doing consultations over the telephone. So yeah, it's disappointing to hear how your experience has been.
Would you have any advice for someone like Rachel who's been given an appointment with the clinic, but maybe it's a year away or it's a long way away? What should their next steps be?
I mean, I think usually in primary care, so in your GP, there's usually a doctor that has an interest in women's health. But again, it can be a long wait time. And I'm wondering whether it's because you require such a kind of niche specialist input. And unfortunately, there are just not many level 3 specialist menopause clinics in the country. And it is back on the agenda, and hopefully more funding will be pushed towards it, so that we can train up more people. But it would be to go back to the GP really and keep pushing. It's a case of demand at the moment outweighs capacity, sadly.
And what do you think, Sarah, about obviously we know kind of GPs don't have the time often or the money, because I think they have to fund the menopause training themselves. Is that correct? And what are your thoughts on that, and how can we improve things, kind of education within the medical system?
Yeah, I mean, I think for most healthcare professionals, we kind of accept that you have to fund your own courses. That's across the board for everything. I mean, sometimes you're able to get the money back. I think that there is more of an interest in menopause. There's definitely more of a recognition of the impact that it has on kind of the wider society. And I think potentially if workplaces were to kind of embrace the challenges that women face when they go through the menopause and reflect on how it impacts in the workplace, then maybe they would start to fund some of the care for women, which would make a huge difference.
Yeah, absolutely. Dr. Sally Ghazala, do you want to come in here?
Yeah, can I say something? So menopause is a natural process of aging, and no woman should be ashamed of having this, because this is a normal process of aging, like starting with the period. This will end. The production of hormones sometime after 30 years will end, and no woman in the UK or anywhere should be ashamed of having this. And yes, we have to talk about it. Yes, it has a severe impact on women's health, like you said, the fatigue, the foggy brain, the hot flushes, and everything that comes with it. And I think lack of knowledge and feeling ignored and rejected and skepticism about this, like it's something we don't want to talk about it. And sometimes, as Rachel said, that she didn't even want to talk about it to her friends, because there's something that women are ashamed. I talk about it to my friends because this is something which is very normal, and we have to talk about it. Yes. So if we talk about it, it means that we can we can treat the symptoms, not the menopause itself, but the symptom associated with the menopause. And as Sarah said, yes, a lot of doctors, and a lot of health professionals, they really don't know menopause and the impact on women on the workplace, and how much it can really impact us women. And yes, for example, I would like to go for courses, and I have to pay for my own courses, yes, for my own development, for better health, for better patient care. Otherwise, as Sarah said, yes, it's something that we have to do it, unfortunately, yes.
Thank you, Sally. And how do you approach, obviously you must see a lot of women in your clinic at Integro who are using cannabis medicines.
Yes, for my clinic as a pain consultant, I sometimes treat women with pain, vaginal dryness during menopause, pain during intercourse, yes, and it does help with this type of pain, yes, pelvic pain or abdominal pain during intercourse. And this I see, and a lot of patients, they say that it does help with this type of pain, yes. Yes. And it does have a severe impact, Dr. Menopause, also in not just in women, also in a relationship with a partner, because it's something that, yes, it affects.
Thank you, Sally. Rachel, if it's not too personal, picking up on what Sally said then, how has it impacted your relationship with your partner, and have you experienced any of that kind of pain that Sally alluded to?
Yeah, so at first, I touched on it earlier, so my worst symptom was the dryness. That was probably the worst thing I felt. The dryness was so bad, I had thrush pretty much constantly for about 6 months. So this was the worst thing. I was back and forward from the doctors, trying to sort out having thrush. And actually, again, I've sorted that out by myself, to be honest, by just being careful with what underwear I wear and taking probiotics. It's not actually been anything to do with the doctors. I just kind of, I've done a lot of like just research myself and found out what works. And now it's totally fine and it's manageable. If I don't take my probiotics, I notice it's worse. But yeah, the dryness at first was definitely quite bad. In terms of with my partner, I guess, yeah, that does affect things. But I think it's something that you kind of gradually over time, just, you're really cautious at first because of all these new symptoms, and then you just sort of learn to live with, and it is now fine. But I would say, I mean, I've gone through this situation for 2 years now, just over 2 years or 2.5 years or something. And I would say now it's fine, but it has taken a while to get to that point. I don't think it's not a switch that you can just say, oh, it's all fine. I mean, yes, low libido is definitely a symptom that impacts a relationship. Again, personally, I take maca root for that, and I find that really, really helpful. And it's just about open conversation with them as well, really, I would say.
Yeah, absolutely. It's really important for men to be involved in the conversation. And you sort of said before, you know, you would be open to treating your symptoms naturally. It seems like you really try to use alternative medicines and natural therapies. Would sort of looking at full extract cannabis be an option for you if you got to the point where you felt it could be beneficial?
Yeah, absolutely. I just think, if possible, like everything natural. I think that it's just amazing what you look at. So I actually wrote a blog, which was 6 supplements I personally take after having a hysterectomy. And it's crazy how much traffic it gets. I would say like every day I have 2 or 3 people on my web chat asking me questions about it. And that shows how much people want to learn about how to help the menopause with supplements.
Yeah, absolutely. And Dr. Bodani, just before we move on to sort of some further questions, do you see a lot of patients in your clinic that are going through this change in their life that might benefit from cannabis medicines for sleep and anxiety? I think we sort of touched on it earlier.
I think it's important, whatever the speciality that a particular doctor is working in, whether it's general practice or whether it's obstetrics and gynecology or even general surgery, it's important to be wide-angled in the approach to the patient, because whether the symptoms are menopausal or whether they're specifically mental health, I think one has a duty as a doctor to actually look at the whole patient and not be siloed into thinking that my own responsibility here is simply to deal with the pain. I'm not really interested in the psychological aspects of pain, because really the remedy for dealing with, say, chronic pain is psychological as well as medical prescription. In the same way, menopause, if it's perimenopausal or whether it's it's advanced early ovarian failure or it's surgical menopause, one has to look at the whole picture. And I think in Rachel's case, one's dealing with a very young woman who has anxieties about fertility, or had anxieties about fertility, but also about the consequences of surgical menopause in terms of how it's going to change herself as a person, how it's going to affect her relationships, whether she would be, able to talk about this with her friends or family. So any doctor, whatever their specialty, has to really look at the whole problem. And if they don't really feel able to deal with the whole problem themselves, I think it's important to refer early and to seek help. And even though nowadays we have a tendency to super specialization, so there are what's called gypsies, which are general practitioners with a special interest in. General practice is very much a community of doctors, and all the doctors have broadly the same types of training, And even if one particular doctor has specialized in, say, gynae matters, or another doctor has peds experience, it doesn't mean to say that they don't actually meet and talk in the coffee room, or they talk about patients in the clinical meeting. They can share their expert knowledge, and they can help all the patients who come to that clinic. Similarly, most hospital doctors work in the community, and really, there's nothing to stop us from saying to our colleagues, look, I've got a patient with a menopause issue. I'm not entirely certain whether what I'm doing is right, but what do you think? And I don't think there's anything in the medical textbooks or the medical sort of guide to how to practice to say you don't talk to your colleagues, and you improve yourself, you improve your own knowledge. That's the whole point of having annualized CPD that we all have to do. We can all sort of nowadays tune into very excellent educational materials free of charge. We don't have to go to paid courses. In fact, I've seen on one of the chats just now that the Newsom Center is offering free training. So I think it's available to everybody, and doctors included. We're not now regarded as the fonts of all wisdom that we once were, and I think we accept that patients sometimes can be more informed than us, and there's really no hierarchy here. It's about getting the best for the patient based on everybody's collective knowledge.
Yeah, absolutely. Thank you. I think that's a really important point. Unfortunately, I don't think Helen is going to be able to join us due to her internet difficulties. So I'm going to move on to questions from the audience. So if anyone else has got any questions that they'd like to ask our panelists, we've got a bit more time to go through those. So please do send those in. I'm going to start a pick up on the point that we've just ended on there, and a question for Dr. Sally Ghazala is, how much training do GPs actually have in the menopause at the moment, kind of as it stands?
Actually, I am not a GP, and this is a question I can't answer. Maybe someone else, because I'm not a GP.
No problem. Sarah or Dr. Badani, do you have any insight on that?
Well, obstetrics and gynecology is one of the mandatory modules that every doctor has to do in their training. So in 6 years of training, pediatrics, obstetrics and gynecology, general practice, general medicine, general surgery, these are the core time that is given to training in those areas. So beyond that, it becomes very much a matter of your interest. And I'm certainly aware that general practitioners do, certainly as part of their training, have exposure to obs and gynae, either as a rotation, 6 months of it in the hospital, or they can do specialist qualifications from the Royal College of Obstetricians and Gynecologists. It's called the DRCOG. Even beyond that, I think we're all learning. And I don't think it's really true to say that a GP would only get 3 hours of training in obs and gynae. I think that would be very sort of inaccurate. Just from my own experience as a medical student, I delivered 12 babies at Staffordshire. As part of my training, I wrote up lots of cases in gynecology, and that was all normally part of my training. And in my general practice attachment, I did a survey on women's health. So every doctor, I think, is exposed to quite a lot of training in everything. It's not 3 hours. It certainly depends on interest, but also there is a fundamental basic level of knowledge that you have to pass exams.
Yeah, absolutely. And I think it's important not to kind of blame individual GPs and doctors in this situation. They do have a lot of training on a lot of different subjects, and unfortunately it's just kind of women's health is just generally not taken as seriously, but that's a societal and a systemic issue rather than on an individual basis. Sarah, we've had a couple of questions about HRT and about the risks and what people's views are on it. I wondered if you could take this one. First of all, what does everyone think of HRT? I've heard that the risks are based on very outdated research and it is perfectly safe for women.
Yeah, I mean, for the majority of women, HRT is very safe, and the benefits of being on it do outweigh the risks. And for actually women who start HRT before the age of 60, their outcomes are much better. For in terms of cardiovascular disease, diabetes, this is shown to have some neuroprotective kind of benefits, also in terms of bone density. So I am an advocate for HRT, definitely. I think the studies were a bit outdated and maybe misinterpreted, and people get quite excited about the risk of breast cancer, but actually your risk of breast cancer can be increased equally by drinking alcohol, you know, a few glasses of wine per week as well. So it's about putting things into context, and yeah.
Yeah, absolutely, 100%. And just to lead on from that, can you use HRT alongside cannabis medicines? Do you have any insight on that?
I haven't had experience of women using HRT alongside cannabis medicine, so I wouldn't be able to comment.
No worries.
Any of the doctors in the medical cannabis clinics would be.
Yeah, Dr. Ghazala or Badani, do either of you have any input on that?
I think I do see some women using CBD, I mean, cannabis with HRT. Yes, I have come across women using HRT. Yes.
I think one of the main side effects of hormone replacement therapy is the slightly increased risk of venous thromboembolism. And in terms of combining cannabis medicines with HRT, I think the issue is whether there are other medical conditions that the patient has which require anticoagulation. So we know that cannabis-based medicines can alter coagulability and also the effect of anticoagulants. So it's always on a case-by-case basis, assessing risk and benefit.
Yeah, absolutely. And this is probably a good point to say that she's obviously not on this webinar, but Dr. Danny Gordon is really well versed in this and has prescribed to a lot of patients with cannabis, cannabinoids alongside HRT. So if anyone is particularly interested in that, she's probably a good person to look up her work. And I did interview her for Cannabis Health a few weeks ago, so we can share that link in the chat if that's helpful for people. Okay. So Dr. Badani, sorry to come to you again. We've just got a question here that says, is there sufficient evidence to say CBD oil works? Which is a big question.
I think the key words there are evidence. And I think there is anecdotal clinical evidence in bucket loads from different patient histories, and I think we've had a very good patient advocate in Rachel telling us about the benefits that she's particularly experiencing CBD, and I think that story would be replicated manyfold. What we are lacking, however, in terms of this question about evidence is the motivation and the funding to do large-scale trials with patient groups which are appropriately controlled for variables and are randomized in the way that is accepted as different levels of corroborable evidence. So randomized controlled trials, which are difficult to do, especially if they're meant to be, large numbers involved and blinded and against viable comparisons. That kind of evidence is really what NHS England, NICE, all of these sort of regulatory bodies are calling for. And the trouble is, these studies are not currently being done because nobody is really willing to fund them. And until we have such studies done, we won't have the kind of evidence that those people who are commissioners of services or those people who hold the purse strings and can influence prescribing habit, it won't happen. So unfortunately, as Rachel was saying, the need to go to private doctors, and let's face it, Integra Medical Clinics is a private clinic, and the patients who come to Integra must have a certain degree of ability to pay. It's not nice, but without the ability to pay, the benefits of cannabis-based medicines are not really being felt by the large numbers of people who could benefit. But without the evidence, we're not going to get the funding. And without the evidence and the funding, we're not going to get large-scale NHS approval for the use of these drugs, apart from very limited indications, like at the present time, spasticity in MS and very rare types of treatment-resistant epilepsy in children.
Sorry, I just did that to myself then. Rachel, do you want to add anything to that? Maybe sort of any anecdotal things that you've heard from your sort of clients and customers, or anything that you've experienced personally, sort of to show that, to sort of suggest that CBD is beneficial?
Yeah, I mean, we have well over 100 5-star reviews that I know are so genuine. They come in, I don't ask people to do them. They are completely genuine reviews that people have taken the time to write because they have found it helpful. I actually have to be really careful with what I display on my website, because you're not allowed to make claims about how CBD may help with any health. So you won't see a lot of reviews on my website making any claims, because I would get in a lot of trouble if I did. But I do know that I genuinely get them, and that's my main motivation, to be honest, to continue what I'm doing every single day. The more the business builds up, it's been 18 months now, we get a review pretty much every day at the moment, and every single day I'm just inspired to continue doing what I'm doing and trying to help people and spread the word about something natural that might make even a small difference in their life. So I definitely, I think I get a lot of real reviews based mainly around anxiety, sleep, period pains, which is obviously not that relevant right now. And I do get some about the menopause as well, if some older woman that is going through menopause naturally does try it.
Yeah, that's really interesting. And certainly I know I can say on anecdotally that I hear from a lot of people on a daily basis who find it helpful. So there definitely is, it does suggest that there is something behind it. We have a question here for our clinicians on the panel about whether THC affects estrogen levels. I don't know whether Dr. Ghazala, you could answer that at all.
I don't know really the answer to this, if it does affect the estrogen level. Dr. Bidani?
I know that estrogen regulates fatty acid enzymes, particular types of hydrolases, which break down endocannabinoids. So when we're talking about women who have fluctuating levels of the ovarian hormones, the more variability there is, the more variability is going to be in how the endocannabinoid system is working. So the same applies to THC. THC is another cannabinoid from the cannabis plant. So we know that the endocannabinoid system is extremely widespread in the nervous system. There are receptors, cannabinoid receptors 1 and 2 at the moment we classify them as, but there are many more subtypes throughout the brain and the spinal cord. And when we give people exocannabinoids, either in the form of CBD or THC, we are actually changing the way the endocannabinoid system works. And hopefully we're trying to do it in a way that is helpful to the patient and relieve symptoms and not doing harm. But at the moment it's an early field. We don't really know all the long-term consequences of using CBD or THC over many, many years. And certainly that data is being collected in registries.
Yeah, absolutely. I just wanted to pick up on a comment that Anne Schlag, who's head of research at Drug Science, has just posted in the chat about how we can take into account real world evidence specifically on women. Does anyone on the panel have any thoughts on that? No. Okay, no worries. Okay.
I'd like to say something about that, Sarah. I think
Yeah, of course.
we need some more kind of I don't know, apps or something built where we can collect data more around how women are using cannabis, how it helps in terms of their symptoms, and have some sort of central database that feeds back into. Then people can start to see trends and see where they think research would be beneficial, or what the kind of leader is in terms of symptoms and management. And that would hopefully feed into kind of other conditions. But I think technology is going to be kind of key in that.
Yeah, absolutely. And just Sarah, while you're sort of speaking, we've got a question here from an attendee who has hypermobility spectrum disorder, and says they've read some literature that HRT is not suitable for those with connective tissue disorders. Do you have any thoughts on that?
I mean, I think that you have to go for a consultation, because it sounds like there's probably more layers to that, and it wouldn't be such a straightforward answer. I think it depends on what the underlying conditions are.
Yeah, absolutely. Okay. Dr. Ghazala, do you have any thoughts on that, kind of from a clinician point of view?
What was the question, Sarah? Sorry, I was.
If a patient has hypermobility spectrum disorder,
Yes.
They've read that HRT is not suitable for those with connective tissue disorders. Do you have any insight?
I think I agree with Sarah. They need to go to a consultation and to go into more details about why they are not suitable for HRT. Yes.
Yeah.
They are not suitable because of hypermobility. I don't think so. But so they have to go and have more detailed consultation about it.
Yeah. Absolutely. Okay, thank you. And Dr. Bradani, do you think it's important to identify which patients, no matter why they are being treated, for example, for anxiety, are menopausal, and could that change the way that you prescribe?
Yes, I think anxiety is obviously a blanket term. Anxiety, one hopes, has a reversible cause in the majority of cases, if it's to do with a transient life experience, which is about some kind of trauma, which can be helped with talking therapies or a sympathetic approach, or some kind of empathetic help, then that's obviously the way to solve it. But anxiety as a presenting symptom is often seen in medicine in a lot of different conditions. So, for example, very common conditions like thyrotoxicosis presents with anxiety, typically to psychiatrists, if that's the first symptom. Anxiety can also present in carcinoid syndrome, which is a rare disorder. It can present with adrenal tumors. So one can't really say that if somebody is very anxious and very different from how they usually are, that it's immediately psychiatric. One has to look for reversible causes. Once that has been done, and it appears that anxiety is the only sort of culprit, but without any obvious triggers, obviously anxiety runs in families. It's very common for generations of different people in families to suffer with similar sorts of symptoms like depression or anxiety or dementia or Parkinson's. So one has to really be careful in assessment. And when it comes to treatment, symptomatic treatment is important. I would say that it's appropriate to use beta blockers. It's appropriate to use short-acting benzodiazepines if that's going to be carefully considered in terms of risk and benefit. When we're dealing with very young people, teenagers or young adults with anxiety disorder, from whatever cause, one also has to consider very carefully whether exposing these young people to cannabinoid types of medicine is actually going to do them more harm than good in the long run, because cognitive development isn't completed until you're in your mid-20s. There's a high risk of addiction or behavioral psychological dependence on cannabis-based medicines. And at the moment in the UK, since the legalization of cannabis occurred, we have got quite strict systems for ensuring that eligibility is carefully assessed, that if cannabinoids are prescribed, there's a justification, it's documented, and there has to be some monitoring so that you can't just write a prescription for somebody and just keep going, repeat prescription, because I think that's going to be very frowned on, and a doctor's competence to practice is going to be put into question if that's all they're doing. So every patient has to be followed up, and certainly at Integro, we have a system for following up every patient with nurse follow-up or medical follow-up. I mean, every doctor at Integro has to see the patient at least once every 4 months. And it can be sometimes a burden for the patients, but the doctors, but I think we have to practice with safety in mind, particularly when new drugs are currently the issue.
Yeah, 100%. Sarah, we've just got one more question from the audience, and this is a attendee who says they're an elderly woman who is still experiencing hormone fluxes. Do you think that cannabis could help with that? And what is your thoughts? Could that still be a symptom of the menopause?
It's quite tricky, really, isn't it? It's quite personal. I mean, I think it's worthwhile, first of all, exploring your symptoms with your GP or with a menopause specialist, and having those tests done. For most women, menopause symptoms last between 4 to 12 years, but for some women it can last beyond that. I think the cause of the symptoms need to be kind of addressed first before you can suggest what treatment would be most appropriate.
Yeah, absolutely. Thank you, all of you there. There were some really tough questions in among that, so I really appreciate you all sharing your insight. I am going to wrap this up a little bit earlier just because unfortunately Helen hasn't been able to join us, but before we go, I'd like to go along each of our panelists and ask them if there's one thing that they would like people to take away from this event. So I'm going to start with Rachel. What would you like people to take away? Oh, you're on mute again.
I'm muted. So mine is something I didn't know until everything I've been through, which is you can ask for second opinions, and you can ask to change doctors, and you can say, actually, I don't really feel like I got on with that doctor. Can I speak to somebody else? And you can ask these things. You have every right. And I did not know this. And I tell everyone now that if they're not sure about something or they don't feel they got the right answer, I'd say ask someone else. Ask someone else, because like there's a lot of pressure on obviously GPs and doctors, on everyone. And I think someone was saying, just you might mention it in the coffee room and then somebody might know, like there might be somebody that just knows the answer. They're humans at the end of the day. They can't know everything, and there might be somebody that knows, and you're not going to offend them, and you might find the answer you need. And I just wish that I had known that years ago. So I always tell everyone that now.
Yeah, thank you. That's really, really good advice. Sally, what would you like people to take away from this?
Yes, that menopause is a absolutely aging process, a normal aging process for women, and we are not supposed to be ashamed, and we have to talk about it and seek help if needed, because it's really, a menopause is something that affects us women badly, and if we need help, we have to ask for help, and we are not supposed to be ashamed of it at all, actually.
Of course, yeah. Thank you. And Dr. Badani.
Well, I think we're living in a great age for medicine. I think it's phenomenal that we've now got a toolkit which includes cannabinoid based medicines. I think we're just exploring the utility and the efficacy of these drugs. But at the same time, in medicine right now, we have fantastic things happening in non-invasive brain stimulation, gene therapies. It's a great time to be in healthcare, and I think patients as a whole can only just benefit. So
there's hope on the horizon. Brilliant. And Sarah, what would you like to add?
I think I echo what everyone else says, but also is to talk about it, and if you can, create support groups, so whether that be in the workplace or in friendship circles, and use technology to help with prompts, you know, if you're experiencing things like brain fog and concentration, you know, pull in those aids, seek help into everything, you know.
Yeah, absolutely. Thank you to all our panelists, and thank you to everyone who's joined and stuck around, even though it's been slightly shorter than we expected. Hopefully we have answered some of your questions, brought up some topics that you can relate to, and started a conversation. I think I did share the article to the Cannabis Health piece that we wrote a few weeks ago, so have a look for that in the chat. That might be helpful to some people, and we'll send around an email after the webinar with details of Integro and all our panelists, and where you can find kind of our remedy and everything like that. So yeah, and our next event will be looking at what happens kind of after the menopause. So stay tuned for details of that. And we'll look forward to seeing some of you then, hopefully. I'll see you soon. Thank you, everyone.